I'm Carolyn Morgan, host of This Medical Moment. Join me as we hear from entrepreneurs who are changing the standard of care. This Work Break series will take less than 10 minutes of your time, and I promise you'll learn more about the future of healthcare. Would you mind talking to us a little bit about your new career move here?
The most recent development with my career has been entering into the space of prescription digital therapeutics. But there's yet to be an organization that's been incredibly successful in commercializing that. So the opportunity to come to Akili Interactive and be able to build a world-class commercial organization under my leadership is incredibly exciting. What we're doing here is really reimagining the commercial model, but of course, fraught with challenges. The ADHD market is a multi-billion-dollar market, but what we're seeing is a significant number of kids who are uncontrolled or just not well controlled on existing therapy. The current treatment landscape is primarily stimulants. And if anybody is familiar with ADHD and treating the symptoms of the condition with stimulants, it's fraught with side effects. And so with EndeavorRX being really the first innovation in the ADHD space that's non-pharmacological in quite some time and has the credibility backing of FDA clearance is tremendous to me. This therapy has been made with kids at the center. As you're playing the game, is you're playing into your weakness. So it's challenging you to multitask and to really, navigate both with an actual device, but also with tapping different creatures. You're kind of buzzing through, like avoiding obstacles. The result is an improvement in attention over time.
It's amazing listening to you talk about this. There's just such a unbelievable entrepreneurial spirit shining through, and it's clear that you found a really great home.
We had this incredible early interest in EndeavorRX. In fact, we have a list of what I would consider to be hand raisers who want to know as soon as it's available more widely commercially, tens of thousands, without spending a single cent. Wow. In any sort of customer acquisition. Being able to capitalize on that early interest, I think, is going to be so important. But the second part of that is building advocacy, right? I mean, that's going to be your strongest grassroots effort behind EndeavorRX, and really accelerating awareness and trial is going to be other parents really being able to articulate the tangible outcomes that they're seeing to their peers and be spokespeople, essentially, informally, for what we're bringing to the marketplace.
It's a new frontier and one that has been challenging for a lot of companies to be successful at. I'm curious, what are some of the challenges that you found as you're starting to develop the commercial organization there?
There's really no analog to look towards, right? This is a brand new modality of medicine. And especially entering into a market that's incredibly well established, that has entrenched behaviors, such as ADHD and the treatment of such, has most definitely proven to be, a great challenge that we have the opportunity to overcome. To get people to rethink what medicine can truly be is something that I think we have the opportunity to do at Akili.
Well, we've seen other companies try this and struggle, candidly, and it seems as though you guys are off to the races. What are 3 tips that you would give to other leaders and organizations that are trying to come down the same path?
First and foremost, don't try to locate an analog. That's my first bit of advice for anybody who is looking to commercialize a prescription digital therapeutic. There are none. The second bit of advice that I would offer anybody in a role like mine would be to build an incredibly diverse and nimble team that can in turn help you craft an incredibly creative but scalable and optimizable plan. All of that, I think, is going to be critical to figuring out what's going to work and what isn't, right? Experimentation has to be at the core of whatever we're doing here. because trial and error is how we're going to learn what's successful from a commercial perspective. And I think the last piece is just building a culture of openness and facilitating ideas and new ways of thinking while really driving home acceptance of that, but resiliency as well is going to be really important too, because we're not going to all be successful all the time here.
Meghan, you've shared such an inspirational story, and this is certainly going to be a game changer in the market for all of these kids and their families, and we can't wait to watch it all unfold.
Thank you so much, Carolyn.